Welcome to the last of three recordings. I'm Dr. Audrey Pottinger, and in this session, we will be looking at the challenge that some parents have in managing the different relationships in their household. For example, some families have elderly relatives living with them, and with the prolonged restrictions placed on senior citizens, some elderly have been showing signs of what we call stress-induced dementia, where their forgetfulness, poor memory, and withdrawal have been worsening. And of course, with school and work now remote, parents are sharing space 24/7 with their children and spouse. So, although the focus has been on isolation caused by the pandemic, we also need to consider crowdedness. And unfortunately, being crowded can increase risk of violence and abuse. So how can parents mentally manage the different relationships in their homes? Well, firstly, an attitude adjustment. Embrace this new norm. Don't fight what you cannot change. Reframe your thinking. Focus on the positives. It could be that with everyone at home, you could be seeing new strengths emerging among family members, or you're better able to closely monitor your children. And we know that some persons will not readily adapt to the pandemic because of their personality. So, as the parent in charge of your household, acknowledge those who are at risk. It could be your daughter who worries a lot, and so the fear of catching the virus may ramp up her anxiety level. Or your spouse who obsesses about needing to have control. Or you've always been a sociable person, but now you don't have the social outlets, so you may be at risk for engaging in self-destructive habits. Another suggestion is retooling, that is, using what you have optimally. If you have to share space, organize, develop structures, create routines. An overcrowded home requires multi-using of space. So carve out niches for each person with the mandate to keep the space neat and clean. And that includes the child getting out of bed each morning and making the bed. A neat space makes for a better frame of mind. And even though school, work, and home life are in the same space, create structures and daily routines, including outdoor and exercising. And schedule clear family times when the family gets together, but also recognize the need for individual on your own time. And don't forget me time. Retooling may result in stronger family relationships. Now, what about Grandma? She has become less alert, forgetful, and isolating. You could identify the desired outcome, remove obstacles, plan to achieve the goal, emphasize safety. So, the desired outcome could be to actively re-engage Grandma, but the obstacle is she's withdrawing. So you plan to engage her by assigning her new tasks and caring responsibilities within the home. Teach her how to use the internet, listen to and rap with her. Now, for the home with a potential abuser, that requires a SOS. If you, your spouse, or a young adult relative is lashing out in anger, seek appropriate outlets, such as a good physical workout may release pent-up anger, but you may need to contact the authorities, the police, or child protection agency. Also, find alternative shelter for yourself or child if necessary. So if you recognize that you or a family member is not coping, reach out for help. Tell a friend, your neighbor, church sister or brother, your doctor. Seek guidance from the police. I have provided a list of resources that you can get help from. Check it out. But please do not remain in a state of anxiety, fear, depression, anger, or rage. These are not responses you have to accept or tolerate in others. We really need to remove the stigma from reaching out and getting the help that can allow us to better manage our feelings and relationships. Taking good care of our loved ones and our relationships require good mental health practices. So I wrap up with the reminder, please stay safe, be calm, and remain positive. Thank you.